So, we'll continue our session about the bedsore and the mobility. So, then we reach up to the condition that affect the urinary system. The nursing diagnosis is related to urinary system that also it has a relation with the bedsore. Potential for infection related to static urine. So immobility also, it will lead to stasis of the urine, and also it will lead to urinary tract infection. Fecal elimination also, this is fecal Q is extra. Altered bowel elimination, constipation also, it will lead to constipation. The immobility, it will lead to constipation and reduced physical activity. About the integrity of the skin, potentials or actual impaired skin integrity related to physical immobility and pressure and or shearing force. So those are the nursing diagnosis which is related to immobility or impaired mobility according to their effect on each body system. Now, there are some material that we can use it which help in the prevention of bedsore or prevention of friction and prevention and decrease the pressure, distributing the pressure to more area of the body, like medical sheepskin. الجاعد باتتا ها الجاعد ما تعرفوه؟ جاعدة جاعد الغنم كاملة لا مش هيك بتسموها اللي شيبسكن الصوف تبعها مع الجلد after it is cleaned and properly. In this case, why it is good? Because it will keep the air is coming in between that hair of that sheepskin. So it can be used under the patient, but also it depends upon the weather here. If it is at home and the AC is not cooling well in summer, this also it will cause more sweating. Air mattress that will also, the mattress is filled with air, it will keep the fluctuation, also it will take the care of the body. So the mattress, it will take the care of the body, so it will distribute the pressure all over the body. It will reduce the pressure on a bone prominent area. And water mattress also, it will give the same thing. There are some mattress also which will give intermittent fluctuation of the distribution of air in the mattress itself. So it will change the pressure from area to area. So it will make a wave, like a wave, while the patient is lying on that bed. So those are some example of what we can use in helping the client to avoid prevention of bedsore. In assessment, also we have what we call it the Barden scale and Norton scale. This is assessment of bedsore. What does each one include here? It includes the sensory perception, also friction and sharing ability, sharing force, ability to control body position, skin moisture, nutrition, nutrient intake, and activity level. The Norton scale include the physiological condition, mental condition, activity and mobility, and incontinence. So here the Norton scale, the physical condition, general physical condition of the client. If the general physical condition is good, here he will get 4. So it is giving mark for each one of those 5. So it will be out of 20. So if the physical condition is good, he will get 4. If it is fair, he will get 3. If poor physical condition, he will get 2. If a very bad physical condition, he is looking too much ill, in this case he will get only 1. The mental condition, mental ability of the client. Is he alert? Can feel, can respond? He will get 4 in this case. Apathic, he is not responding well. Confused, you are asking him something, he will answer in another. So it means that he is not understanding what is going around him. He will get 2. Comatose, he is in coma. He is unconscious. So only we will got 1. The activity. If he is ambulant, if he can move all of his body part freely, no constraint in his mobility, he will get 4. If he can walk with help, here he will get 3. And he can walk, but he needs some help to move. If he confined to chair bound, yani he cannot move without a wheelchair, he will get 2. If he is bedfast or bedridden, he is unable to come out from the bed, he will get only 1. The mobility, here the activity, full mobile, doing all activity, slightly, he will get 3. Limited mobility, he will get 2. Immobile, no movement at all. In this case, especially if he is unconscious, he will be immobile, so he'll get 1. The 5th thing, which is the incontinent. Yani inability to control, incontinence means inability to control either feces or urine. So if it is not there, if he can control his passage of urine and stool, in this case, he will get 4. If occasionally he is passing or some drops of urine is there, in this case, he will get 3. If it is yes for urine, or in this case, he will get 2. If it is for both urine and feces, he cannot control the urine and feces, in this case, he will get only 1. So, in this chart, we will use it to assist those patients who are at risk daily. We have to assist them. So this will assist the general condition of them. So if they got 18 or more, because 4 and here 1, 2, 3, 4, 5, 4 by 5 it is 20. So 18 out of 20. So in this case there is low risk. the risk is very low. If it is between 18 to 14, then in this case, medium risk will be there. In this case, it means when there is a medium risk, we have to take a precaution. We have to give more nursing care for that client in order to prevent that risk. If it is between 14 to 10, high risk will be there. If it is less than 10, a high risk for developing bedsore will be there. So this is how we are using this scaling system in order to see if the client is prone to develop bedsore or not. It has to be done in a daily basis or shift basis even, in order to see what, according to the change on the patient condition, in order to see the risk factor for that client for developing bedsore or not. So the burden scale, assessment score scale, as we said, very high risk, total score less than 9, high risk, total score 10 to 12, moderate risk 13 to 14, and middle risk total 15 to 18, no risk from 19 to 23. There is additional also assessment tool which is identified by the site, often with the aid of diagrams according to the site. So you will assist the site by also it has to be measured and give grading for the score. Grading of pressure sore, as we said, we have stage 1, which is discoloration, partial, we discussed them in the previous session, partial thickness, skin loss, damage, in this case stage 2, full thickness, skin loss involvement, it is stage 4, stage 3, full thickness skin with the skin loss with extensive destruction of tissue and necrosis underlying the tissues, might reach the bone or the joint, it is called stage 4. The guideline for assessing pressure sore, we have to have good light in order to assess properly. Regular temperature, we have to regulate the temperature of the environment prior to the beginning of the physical assessment. Also, inspect the area of any which or redness, whiteness or redness area, or discoloration can be caused impaired circulation in the area. Inspect the pressure area for abrasion, if there is any abrasion in there. Inspect the pressure area for amount and color and consistency and odor of drainage, if drainage is there. Palpate the surface temperature of the skin over the pressure area. Also increase the temperature is abnormal and due to inflammation or blood traveling to the area. Palpate over the bony prominent area. About the rules, of the nurse in prevention of bedsore. What's our role as a nurse in prevention of bedsore? We have, as we said, we have to do assessment, palpation and inspection technique daily to evaluate the bony prominent area of the skin. Ensure an appropriate nutrition for the client. So we have to be sure that and ensure the nutrient level of the client, the nutrient intake. Provide medical device in order to prevent bedsore, like special mattress and special cushions sometimes, or rings, or support even we can use sometimes some pillows and bed sheet to support the curved area of the body in order to distribute the pressure all over the body. Keep the patient clean and dry. Keep the patient's skin clean and dry. So cleanliness is the key word for prevention of bedsore. Manipulation of the environment. Smooth the wrinkle-free bed. You took bed making? You took bed making? How to arrange the bed? So when you are arranging the bed, you have to avoid wrinkles in the bed sheet, because wrinkles also it will increase the possibility of bedsore. Use of special mattress like foam mattress, artificial sleeping sheepskin. Sometimes we are using either artificial or we are using the sheepskin itself, but treated one. Elevating the head of the bed to 30 degree. Ongoing assessment of the client regularly. Positioning of the client every 2 hours. For those who are confined to bed, we have to change their position every 2 hours. We should not keep them in the same position more than 2 hours. If it is done more than that, more frequently, that's better. In a six body position, which is back lying, side light, right side lying position, left side lying position, prone position. So all we have to use all the position. Good nutrition, high protein diet with vitamin C, because vitamin C it has a role in the skin integrity. Also, hygiene of the skin and dryness of the skin. Teaching also the patient how to prevent the bedsore, and teaching the caregiver. If there is a caregiver or attendance, also we have to teach him about the importance of the care of the client and how to prevent the bedsore. This is if the client is confined to bed, so we can use also some small air mattress under the patient client, keeping the head, the body erect. Also, every now and then to move forward and backward, and in order to change the position and keep aeration between the back of the bed and the back of the patient. Also using hand to push himself in order to give some movement that will help in the return of the blood supply to the buttocks area. So it can be by pushing himself. This is supine position. When the patient is in a supine position, how we are supporting him by pillows under the knee joint, and below under the spine, below under the neck. How we can support also the leg, and how we are supporting also the patient foot. This is the side lying position. See here, we are using a pillow under the patient hand and a pillow in between the two legs of the patient, and sometimes we can separate the legs together. So in this case it is a semi-prone position. Semi-prone position. So it is in between prone position and lateral position. So the legs will be away from each other, and the mattress, it will keep the pressure, it will decrease the pressure from the heaviness of the two legs on each other. So in this case, this area, it will be more prone to bedsore if we are not taking care. This is the prone position, and see how we are supporting the client. We are supporting by the pillow. It is in front of the lower leg. About the gait, so in assessment of the client, the first thing that we are assessing is the gait. When the patient is coming, how he is walking. Is he able to walk by himself? Is he using some device that will help him in walking, like the crutches or the walker that he can use, or the wheelchair? So the gait itself, it will give an impression about the ability of the patient to move and exposure to, and also other things. What are the risk factors in this patient? If we are taking this patient, what are the risk factors that is there regarding mobility? What he is having? He is having fracture, and it seems that plaster of Paris is there here. See, it is covered with something here. So in that, also that's the edges of the device that is used. Also, sometimes it will lead to formation of bedsore. The edges of the device here, because it will lead to friction of the skin. And also here, this patient is obese, so if he is confined to bed, there will be more chance for getting bedsore. So now he is mobile, and he is using the crutches. So in general, when we are evaluating the person for mobility, we have to evaluate his ability of movement, each joint, how it is moved. We have to see if he is able to do the full range of motion in each joint. We will take it joint by joint. Did you got that in physical assessment? The movement of the joint, how we are assessing the movement of the joint? If we are assessing the neck, what are the movement that can be done by the neck? Yeah. So extension, flexion, lateral rotation, right and left rotation. So hyperextension, hyperflexion. So those are the movement that if we are taking the finger, flexion, extension, the wrist joint, flexion, extension, and we have here pronation, supination, flexion, extension. So all of those movements, we have to see, is the patient able to do those movements or not? This is an evaluation of your patient mobility. Is he able to bend himself, do also twisting? We have to see all the joint movement in order to detect if there is any defect in the movement and in the ability of the client to move. By that, you have to put your plan for care if he has impairment in the movement. Then activity tolerance. Is he becoming tired when he is doing some activity? what kind of activity that he can do without extreme change in blood pressure and heart rate and respiratory rate. Yani for each one of us, we can tolerate some kind of activity. Yani if I told you, all of you, just run from here to Alaya. How many of you will get tired? And where did you get tired? How many meter or kilometer you can run without getting tired or and tolerating that? If you are going upstairs using, so are you able to use the stairs, or you are going toward the lifter? So this is the activity tolerance, we call it. So we have to assess the ability of the patient to do activities. Some of you feeling tired even from sitting. Huh? Feeling tired from rest. Huh? So this is, we call it the activity. We have to assess the activity tolerance. Then the level of nutrition. Then if the patient is having other disease, that will affect also his mobility. Like heart disease. Heart disease, it will affect also the tolerance of doing exercise. Respiratory disease, also it will affect the tolerance. So by that we are trying to assess all factors that will interfere with mobility. The nutrition, then the general physical condition. All of this, it will have an input in our body, and either it will give a risk factor to develop bedsore or something related to mobility, or it will give us as a positive effect. Any question? Okay, thank you.